We're still waiting for the Florida Department of Health's data due next week, but experts say a lot of that data might be skewed due to the at-home testing going on. News 6's Treasure Roberts is live in the newsroom for us tonight, talking with those experts. Treasure?
Yeah, Matt, experts say COVID-19 data may be inaccurate, and it's because of the choices people make at home. Thousands of people have received at-home COVID tests, but not everyone is sending in their results. Doctors say there's a slight rise in COVID-19 cases because of the BA.2 variant. The subvariant is more contagious, but Dr. Ali Mokdad says it's not a cause for concern.
That rise is mainly due to change in behaviors.
More people are traveling, mingling indoors, and less people are wearing masks. Dr. Mokdad says about 25% of people are wearing face coverings around the U.S., the lowest since April 2020.
Because of change of behaviors and waning immunity from vaccines and previous infections, many people are susceptible and they're getting infected.
But of all the people getting infected, it's not reflecting in the COVID-19 data. Mokdad says it's because many people are asymptomatic and others aren't doing their due diligence.
Many people right now are testing themselves at home using these home tests, and they don't go and report it to the county.
Although the number of cases itself may be lower than it should be, Mokdad says the incomplete data is not masking a big surge.
We're slowing down is not because we're underreporting, because COVID-19 infections are slowing down in our community.
He says that could change, though, come winter.
All of us who have received a vaccine or a booster, 5 months after that, if we don't get another booster, we're susceptible to getting infected.
Mokdad says before the winter season, we'll need another vaccine. If that doesn't happen, he's projecting a surge. By that time, we may have new methods of getting tested. The FDA granted emergency use authorization to a new COVID-19 test. It's called the Inspect IR COVID-19 breathalyzer. It can detect infections with a breath sample, and the device can yield results in about 3 minutes. In a study of 2,409 people with and without symptoms, the FDA reports the device could spot 91.2% of cases. Dr. Mokdad says it's too early, though, to tell if this device will be a reliable method.
We shouldn't tell the public to use a measure or a test if we don't know it's accurate.
As for those of you still using at-home tests, Dr. Mokdad says it is very important for you to report your results so your county can track cases. He advises you call your local health department. In the newsroom, Treasure Roberts, getting results, News 6.